It's exactly 9:15. This is News and Views on Salam Media, and a very big and warm welcome to our Polokwane listeners on One Nation FM. We're moving on, and our next guest is Dr Mvuyisi Mzukwa. He is the chairperson of the South African Medical Association, and we're going to be looking at the issue around the fight against the NHI bill. A very good morning to you. Welcome to the program, Dr Mzukwa.
Good morning to you and to your listeners, and thanks for having me in your program.
Well, we've been long wanting to have this type of a conversation because undoubtedly there are huge concerns regarding the introduction of the NHI. As you and I speak, I know of very many young healthcare professionals who are looking to emigrate. There are also people who are making suggestions that they're going to be cancelling their medical aid memberships because it's pointless. They're paying huge sums of money, and according to them, obviously, that the services are going to be absolutely equalized. They too will have to stand in a queue or make appointments to be seen to. Let's start at the other concerns as well. We know so many concerns have been raised, two of which I've just mentioned now. But obviously, there's what the medical aid is saying, not the medical aid, the architects of NHI are saying that the issues I have just raised now is fear mongering. And even though some of the concerns they say are valid, with so much at stake, they are saying that these issues must be treated with circumspection. There's also the issue of health departments all around the country that's going to be closing down, and those people are going to be losing their jobs. So a whole host of issues, and I'm wondering, have they even looked into these matters? Over to you, Doctor.
Thank you so much for raising those issues. I think we always have to emphasize the fact that the South African Medical Association is a representative body of doctors, representing doctors from the private sector and the public sector. And the other thing that we want to raise is the fact that we fully affirm and also support the universal health coverage as envisaged by the World Health Organization. That is obvious. It talks about equitable access to good quality, affordable, safe healthcare system that leaves no financial hardship to its community. Now, if you look at that and compare it with the NHI, we are not getting the same thing. Hence, the South African Medical Association is not supportive of the NHI in its current form because it leaves out crucial issues. First of all, it's only a finance aspect. It deals with finance. It does not talk to other pillars of the healthcare system. Other pillars of the healthcare systems are leadership and governance, human resource for health, information systems, infrastructure, medicine. We all know how a funding model works. It purchases services. The NHI communities must be told it is not going to buy equipment for hospitals. It is not going to employ staff in the institutions. It's not going to build hospitals, because if you look at the medical aid system at the moment, it only buys services from service providers, but it does not, employ all those things. It's a similar thing that we are raising with the NHI. We are saying if you are serious about overhauling the whole system, consider other pillars of the healthcare system. Don't only tell people about one aspect, and also tell people that it is going to take quite a long time, before you see the implementation. It is going to take 10 to 15 years. I understand that the paperwork is being done in terms of the legislation, but it's only ideal now. It's not the plan.
Are you still there, doctor?
Yes,
Okay, he's all right. I raise this issue every time I talk NHI with anybody on air, and we've been talking about this for a long time. And the one thing that I keep going back to is that in the UK, which is a first world country who have the NHS system, they are actually reeling with the problems they're sitting with at the moment. They have over 75,000 patients awaiting surgery, and they just, the waiting list is kind of months long. That is a first world country. How on earth are we going to get it right here, knowing that there isn't the political will to introduce something and see it through completion?
well, people, when it comes to the example that made about the NHS in the UK, they are now beginning to say, no, let's not look at the NHS. Let us look at others because the NHS is failing. Initially, we were told about the NHS, and people have been hiding the fact that the NHS is failing. You talk about 75,000 surgeries. We also know about 7.4 million of people who are waiting for appointment, to be a backlog, to be done procedures or to see specialists. And we know that the junior doctors have been on strike because there's no good pay, good salaries. They've been joined recently by senior doctors, consultants, simply because there's no good salary, for doctors there. So, those are all the problems that are, like you pointed out earlier on. This is the first world country, and you are only talking about 5 to 7 million players in South Africa. We are going to be catering for all these 60 plus million in the country. So the tax base in our country is very small. So, but also what we need to point out is that we are hearing people using NHI to gloss over mismanagement of the public healthcare system and the private
Mm.
sector, by the way, because the health impact inquiry has pointed out that government needs to regulate the private sector, but they have never done that. Instead, because of the election next year, they are now using NHI to garner support to remain in power. That's what it is.
Okay, my final question then to you is, do you believe regulating the health sector is going to address our problems, move away from the idea of NHI and regulate the health sector? And what would that then look like?
We have to take into consideration, the regulation of the private sector by implementing the recommendations of the HMI. I think that's the starting point. But the other thing is we need to look at our own public system. We need to look at the recommendations and the reports of the health ombudsman, who's been lambasting the Department of Health for poor leadership and governance in the state facilities. Those are the issues that we need to look at and build more, and also make sure that we do attend to the socio-economic and environmental determinants of health. If you look, for example, I always make an example that I come from the Eastern Cape. I was born in a small town called Flagstaff. In our beach, there is no water. This government has promised people at that time that to provide water in the rural area. And people are suffering from cholera and all these other things. And instead of addressing the water shortages and everything that leads to people becoming sick, people are talking about NHI, the funding, because they want to put their dirty fingers on the past.
Absolutely. Absolutely. Your line is, I think you've got a problem with your network. So let us end it there. Undoubtedly, we will talk with you in the future to unpack this matter even further. And it is very comforting to know that a medical profession like yourself, from SAMA, is talking about this issue, the NHI, and making us understand just how serious it is. But till the next time, as always, thank you indeed for your time and go well.
Thank you so much. Have a nice day.